Hello everybody, my name is Leighton Fink and I am one of the biofeedback providers here at the Positive Choice Wellness Center. So you can see on this screen, my name is at the bottom, Leighton Fink, as well as Lucia Foster Ingen and Cody Gustavson. All three of us are the biofeedback providers. We also each have an MA next to our name, so we have a Master's in Psychology, and that BCB stands for Board Certified in Biofeedback. So let's get into it. Now, a lot of you might have noticed that it says biofeedback for stress and pain management. And you might not be here for stress or pain management, or that might not be your number one presenting issue. However, we talk a lot about these things because most of us have experienced stress, sleeplessness, so our sleep, our insomnia can certainly impact our stress and pain, or pain at some time. And most of us know that our neurological, medical, and pain problems can either be caused by stress or can be made worse by stress. So stress can certainly make things worse. In 2018, the American Psychological Association did this study and found that 79 to 90% of doctors' visits were for stress-related issues. In addition, a third of Americans said that they were living with extreme stress, and almost 50% said that they believed that their stress had increased over the past 5 years. So stress is a really big factor affecting a lot of us, and certainly when it impacts our physical and psychological functioning, it's something that we want to take note of. In this same study, 77% of the people reported experiencing the following physical symptoms. So things like fatigue, headache, upset stomach, muscle tension. Even things like risk for heart disease and your risk for stroke can go down when you're doing biofeedback. So these are all things that you might have been referred for or that we might discuss in session. And then 73% of participants reported experiencing the following psychological symptoms. Things like irritability or anger, feeling nervous, lacking energy. Even things like substance abuse, eating disorders. Again, all things that we might be seeing you for biofeedback. So biofeedback at its core is a tool for managing your stress and your pain. We use slow diaphragmatic breathing to help you control your body's reaction to these things. And the computer will show you how is your body reacting to stress, how is your body reacting to pain, and how quickly and how easily are you able to get into a nice relaxation response. The goal is to help you become aware of this connection between your mind and body and learn how to manage your own symptoms at home using the tools that we'll go over in session. So what we're really looking at is the autonomic nervous system. And the autonomic nervous system has our sympathetic, or fight or flight nervous system, and our parasympathetic, or what we sometimes call rest and digest. The sympathetic is everything that happens if you needed to fight something or run away. So your blood pressure goes up, your heart beats faster, your digestion shuts down because we don't want your energy going to your stomach. We want it going out to your limbs so that you can fight or run away. The freeze response is often included in sympathetic nervous system activity as well. Stress response can be us freezing. And then the parasympathetic nervous system, it really acts like a brake on that sympathetic nervous system. So it can help restore digestion. It can help us relax. It can help slow down our heartbeat, help our blood pressure go back down, all of these things. And there is a really strong connection between our sympathetic nervous system and our parasympathetic nervous system because they both innervate different parts of our body and they really work in balance with each other. So on the left-hand side of this picture, you can see the sympathetic, the fight or flight response, does things like relaxes the airway, which I know it might be counterintuitive, but when we actually have more relaxation in our airway, we breathe faster because the air is bouncing around. Whereas when our airway is constricted, as with the parasympathetic response, our air can flow a lot more smoothly between the lungs and outside so that our breathing can slow back down. Sympathetic nervous system speeds up our heart rate, parasympathetic slows it down. They work on our pancreas, on our gallbladder, on our intestines, all kinds of things are associated with sympathetic and parasympathetic nervous system. And really what has become an issue and what we're trying to combat is that our bodies are responding to things in our environment that don't pose a physical threat to us as if they do. So fear is a natural response in our body. It's a survival response that's developed over time for us to be able to respond quickly when there is something threatening to us. Our body reacts the same to things that just cause us anxiety. So I don't mean to say that they're not things that might be threatening. For example, if I haven't been doing well at work, I'm anxious that I'm going to get fired, I'm nervous going in, I really don't want to do poorly. That certainly can present a threat to me because I don't want to lose my job, but my body doesn't have to physically respond to that threat in that moment. But it does. It responds as if I'm being chased. My heart rate speeds up, I start sweating, my hands get cold. I My heart rate variability, which we'll discuss in a moment, goes down. So all of these things are our body activating in the exact same way so that that sympathetic speeds up, our whole nervous system, and the parasympathetic withdraws, that rest and digest. So one of the ways to help combat that is with biofeedback, and we have a few different types of biofeedback that we do here at Kaiser. First, there is electromyography biofeedback. Electromyography measures your muscle tension in microvolts. So you can see that the person here has 3 sensors in the middle of their forehead. This person likely has chronic headaches or migraines perhaps, tension headaches, something where there's tension in their forehead and we want to try to reduce that. So they can see on the screen how much tension there is in their forehead, and then using guided meditations, progressive muscle relaxation, diaphragmatic breathing, can actually see that tension reduce and then use those tools at home to help that tension reduce as well. This is used a lot for chronic pain, for headaches, for temporomandibular disorders such as TMJ, TMD, for paralysis, all kinds of things. Then we also measure what's called your galvanic skin response. Galvanic skin response is a measure of the amount of sweat on your hands. And sweat is really telling us if you're socially stressed, if you're anxious. If you think of being anxious and having cold, clammy hands, our whole goal during biofeedback is to have nice, warm, and dry hands. So if we see sweat on the hands, we want to try to reduce that using the tools that we use in session. Skin temperature is the opposite. We want to see your hands get warmer. Because when we have more of that parasympathetic nervous activity, more of that rest and digest, our body temperature rises just slightly. It's part of why we can overheat really easily in our sleep, because our blood vessels dilate and our skin temperature rises. Then the biggest thing that we do here, our bread and butter, is the heart rate variability biofeedback. So our heart rate variability is a measurement in beat-to-beat fluctuations in the heart rate, and it can tell us how well balanced our sympathetic and parasympathetic inputs to the heart are. So having high heart rate variability means that you have a good balance between stress and relaxation, and having low variability means that you have difficulty bouncing back from stressors. Now this might seem counterintuitive to some of you. So think of it in terms of, we're used to seeing our average heart rate. So say my average heart rate was 70 beats per minute. I don't want my average heart rate to suddenly go up to 80 beats per minute. That's not what we're trying to do. But I want the variability in my heart rate to increase. So, for example, maybe my heart rate is going from 65 beats per minute up to 85, back down to 65, back up to 85. Maybe my heart rate is going from 60 beats per minute up to 80. 60 to 80. Maybe it's going 65 to 75. So in a few of those examples, the second one wasn't quite right. 70 is still the average beats per minute, but there's more fluctuation in my heart rate. It means my heart rate is flexible. It means my heart can respond to stress in a flexible manner. And that's why having that high variability, so having a lot of movement in my heart rate, means that I can get into a nice relaxation response much more quickly and that I'm more balanced. It's also associated with lower blood pressure, less irritability, less digestive system problems, better managed anxiety, and better managed pain. So I want you to imagine for a moment that you've just come back from a 2-week, all expenses paid trip to Hawaii. everything you can imagine was taken care of. It was an all-inclusive resort. Your work was not a problem. Your kids were taken care of. Your spouse was able to go with you. Everything was just perfect as could be on this vacation. You're driving home from the airport and somebody cuts you off in traffic. Now you're likely to feel a little annoyed, a little frustrated, but then you might think back to being in Hawaii. You might even have a moment of like, well, I guess I'm back to reality, but I'm just going to go back to that beach for a moment in my head. And that means that that's because you're primed to be in a more relaxed state. Now I want you to imagine that you have been stressed out. You've been in chronic pain. You've been getting in disagreements with your spouse, with your friends, with your kids, with your parents. You're just worn out. You're not sleeping. And then you're stuck in traffic on your way home on a Friday night. You just want to get home and somebody cuts you off in traffic. Your reaction is going to be so much bigger than it was in the Hawaii example. But why? It's the exact same situation. Somebody cuts you off in traffic. But your body is primed to respond very quickly and in a much more aggressive way right here. You already have that high sympathetic, that high fight or flight activity because of everything that's been going on in your life. Not only are you going to respond much more quickly and perhaps much more aggressively to this situation, but you're going to have a much harder time getting back to that nice, relaxed state, because your body, again, is not primed to do that. So what biofeedback does is it helps take our baseline stress, our baseline anxiety, so that we're starting out at a lower point. And then our body is also able to, with more heart rate variability, react quickly to stressors and then recover quickly from stressors. There's a really big aspect of biofeedback that is associated with our breath, because the increases in our heart rate happen when we inhale. And then when we exhale, our heart rate slows down because of that parasympathetic nervous system. That rest and digest, it acts like a brake and slows back down our heart rate. So even small shifts in the breathing can have a large effect on the body and can definitely impact our heart rate variability. So with slow paced breathing, and I keep mentioning diaphragmatic breathing, that's breathing from your diaphragm, breathing into your stomach so that your stomach is actually going out when you breathe in and going in when you breathe out. And it's a thing that can be difficult to learn, and that's something that we would definitely help you go over and learn in session for biofeedback if you are somebody who has difficulty with diaphragmatic breathing. But with this, you can train your body to be less impacted by stress, less impacted by pain and anxiety. So this is an example of how you'll be connected to the computer. I want you to know that there's no needles or anything, no need for alarm. We're not trying to draw blood or anything. So everything is surface. On the very right-hand picture, you can see that this person has 2 electrodes on her pointer finger and her middle finger. So those are what's measuring her galvanic skin response, or her skin sweat. Then there's also a little tiny thermistor in there that's measuring her skin temperature. And then you can see in that same picture on her right wrist, she has an electrode. And then in the middle picture and on the left, you can see that she has an electrode placed under her clavicle on her left-hand side, under her collarbone. You might not need those in session, but you might, depending. We also can get your heart rate through a finger tip, a little thing that's placed over your fingertip, but sometimes it's not as strong. It's not picking up your heart rate, so we might connect you to those. And then this person also has a breathing belt around her waist. So these are all the different ways that you'll be connected to the computer. If you were doing EMG biofeedback or that electromyography, then we will put the electrodes specifically where you're feeling pain, where we want to measure your tension. So this is a fairly common pattern of breathing at rest. So on the top portion, you can see those peaks that are really nice and even. That is a breathing pattern that this person is not trying to breathe with right now. But in the background of that, you see blue that's kind of moving a little faster up and down. That's because this person is breathing in short, kind of breathing really quickly in short breaths. And then the red in that same box is their heart rate variability. That's their heart rate speeding up as it goes up and slowing down as they're breathing in and out. Now, what we want to see in the biofeedback is we want to see your heart rate and your breath start to synchronize with each other. And we're also really looking at this spectrum in the middle portion. So there is the red over on the right-hand side of the middle spectrum, and then there's blue on the left and green in the middle. The width of each of these remains the same, we're just looking at the height. And the height of the red tells us how much parasympathetic activity you have. That's the rest and digest. The height of the blue tells us how much sympathetic activity you have. That's the fight or flight. And the height of the green represents an even balance of both. So in these two examples, we can see that the people are trying to pace their breathing. So on the left-hand side, their breath is moving along with that breathing pacer for the most part, but their heart rate is kind of doing its own thing. It's not following along with their breath. And that blue in the middle spectrum, that sympathetic, the fight or flight, is really high. Then on the right-hand side, we can see that their heart rate and their breath are moving a little bit better together. They have a nice green peak in the middle of the spectrum, that nice balance between the sympathetic and parasympathetic. But the blue, again, on the left-hand side of that spectrum is still elevated as well, indicating that they still have sympathetic activity. This is our goal in biofeedback. This person's heart rate and breath are moving exactly along with the breathing pacer. In the middle part, that spectrum, they have a nice green peak, and the red and the blue are relatively flat, again indicating a nice even balance of sympathetic and parasympathetic. And then on the right-hand side in the middle of the screen, we can see that blue line that's moving upward. That's their skin temperature. So their temperature is actually going up, which is what we want to see. And the purple in that same box with the temperature on the very bottom is their skin sweat, their skin conductance, or that galvanic skin response. And that's very nice and low. So this is a person who is balanced, who is having a nice sympathetic input and parasympathetic input. Now, part of why the breathing becomes so important is that a lot of us do what is called chronic hyperventilation. So normal breathing is 12 to 17 breaths per minute. And what happens is that when we're breathing normally, we have an even amount of oxygen and carbon dioxide in our body. However, when we're chronically hyperventilating, when we're breathing quickly all the time, we have less carbon dioxide in our body because we're actually exhaling a lot of it on that exhale. So this means that less oxygen can be released into the blood. The reason why less oxygen is released into the blood is because our oxygen needs carbon dioxide in order to move around the body. So when we're breathing really quickly all the time, there is more oxygen and there's less carbon dioxide. So it's part of what can lead to that feeling of tension in your chest, or that feeling that you can't catch your breath. It's because you're getting rid of so much carbon dioxide, your body's not holding on to enough. So the oxygen is actually getting somewhat trapped in the lungs. And this can be what causes a panic attack, or can be related to panic attacks. So I want to emphasize, I'm going to talk about having a nice even inhale-exhale. And this is to create that nice balance between the oxygen and carbon dioxide. However, if you're somebody who does this 4-7-8 breathing, so this is breathing in for 4, hold for 7, out for 8. If you've ever been told to do that by a professional and you find it helpful, please keep using it in whatever capacity that you're using it. But when we're doing our biofeedback appointments, we're trying to have what's called a 6-1-6 breathing pace. So that's just a nice even inhale for 6 beats, hold for 1, exhale for 6 beats, hold for 1. And that's because this 4-7-8 breathing pace, you're breathing in a lot shorter and then you're exhaling longer. And so you're getting rid of that carbon dioxide. So if you're somebody who breathes who's chronically hyperventilating, you're actually creating more stress in the body. So we're trying to create a balance with the type of breathing that we do. So all in all, breathing is a mechanical tool that can help change our body, but it can also impact our brain. It can impact the synapses that are firing and the ways our brain impacts our body, because our thoughts have a physical they physically activate us in different ways. So what is the story that you're telling yourself? For example, what do you think of when you see the word rejection, pain, stress, sadness? All of these things can cause us to feel a physical feeling in our body. We react to them physically, even though they're just thoughts or words that we're hearing. Versus, what do you think of when you hear these words? Peace, joy, happiness, love. We can feel that physically in our body, that we're reacting in a different way. So we're going to look at the way that our thoughts are impacting us. Now, I want to emphasize that we are not licensed therapists, so we are not doing a full therapy protocol or like cognitive behavioral therapy, but certainly our thoughts can impact our physical bodies and can impact our symptoms. So we talk a lot about this kind of connection. So is biofeedback only about breathing? No, though it is a really big portion of what we do. We also do trigger point therapy, which is looking at different areas where you either press on a specific point and feel pain in that point, or have a referred pain trigger point. So maybe you press in an area and you feel pain somewhere else. We can use different tools, like if anybody's ever heard of a Theracane or like neck massagers, different tools to try to release some of those trigger points. Now, this massage acupuncture chiropractor, this is not referring to us. Believe me, you don't want me to be your acupuncturist. But when you go to these appointments, which a lot of people are referred to in conjunction with biofeedback, using your slow breathing can help your relief last about 3 times longer, studies have shown. And then there's also an aspect of rescue breathing. So what we're going to ask you to do with biofeedback is we're going to ask you to practice for 10 to 20 minutes daily at a specific pace. Everybody has a pace where their nervous system starts to really align, where that sympathetic and parasympathetic nervous system are balanced. But we also want you to be able to use it in the moment when you're feeling stressed, when you're noticing that more anxiety is creeping up, when you're noticing that your pain is getting more intense. Using it in the moment is rescue breathing, using your breath to help manage your symptoms in that moment. Whereas the daily practice is using your breath daily to help so that your baseline is lower, so that you're not as activated to begin with. Then there's a big portion that's to stress tolerance. What amount of, for example, anxiety can I still have and tolerate and manage? And how can I get to that point? Of course, this requires a lot of self-regulation and emotional resilience. So biofeedback helps you manage your mind and your body, and it's particularly useful to manage these following disorders and issues. Now, we certainly see people for biofeedback for all kinds of things, so if you don't see what your referral is on this list, that's okay. But these are the things we see most often. So things like anxiety disorders, chronic pain, arthritis, obesity, digestive system disorders such as irritable bowel syndrome, TMJ. And the really great thing about biofeedback, why I think it's so helpful, is that it's all about creating balance in your nervous system. So you might see improvements in multiple areas. For example, if somebody comes in and they have been referred because they have anxiety, and we see this a lot. Maybe they have anxiety, and that anxiety has been causing some tension headaches and muscle tension, and they haven't been able to sleep because they're anxious. And that sleeplessness and the anxiety has made their chronic pain feel worse. And they're also noticing that they're having more IBS flare-ups. All of these things can be improved with some paced breathing with biofeedback because you're just creating balance in your nervous system. So it can impact all these different areas of functioning. Now, our goals for biofeedback are to teach self-regulation for temporary pain relief. Reduce medication use is a really great thing that happens often. And this kind of goes back to the previous slide, because if you're able to manage different symptoms, if you're able to just have more balance in your nervous system, maybe you don't need as much sleep medication or as much pain medication or anxiety medication. It can help improve your sleep, break the stress pain cycle. A lot of us get stuck in this cycle where our brain is saying, oh, I feel pain, and our brain is saying, okay, I'm going to send adrenaline, I'm going to send cortisol, I'm going to hold more tension because I don't want to cause further injury. But over time, sometimes we get stuck in this cycle where our body is still saying, I feel pain, and brain is saying, okay, I'm going to send adrenaline, I'm going to send cortisol, but we actually don't need those things to be sent to us. All of this helps restore balance, of course, in our nervous system, can help with stress tolerance, resilience, and even self-confidence. So there are a few different apps that you can use at home. This is specific to Apple smartphones. The next two will be for Android, so those are coming. But Apple smartphones can use what's called Breathe Plus. This is a nice free breathing pacer, and it's simple. You breathe in as the screen fills up, you breathe out as the screen goes down. Now we ask that you start off with a 5-second inhale, 1-second hold, 5-second exhale, 1-second hold. And if that doesn't feel comfortable, you can adjust it. That's just typically, on average, something that most people will feel comfortable with. Android smartphones, there's both the app called Breathe and then an app called Paced Breathing. And both of these are going to have peaks so that you're breathing in as a little ball's moving up and breathing out as it's going down. Now, Breathe, we have the same inhale for 5, hold for 1, exhale for 5, hold for 1. For paced breathing, we want it to be a slightly longer inhale and exhale because they're not set specifically at seconds. So 6.5 will actually be closer to 5-second inhale. And then lastly, in terms of apps, there's this one called Heartrate Coherence. Heartrate Coherence is an app that you can get on Apple and Android, and it's a really cool feedback app. So what it is you put your finger on the camera sensor on the back of your phone, just like in the picture in the middle. And then you breathe with the breathing pacer on the bottom of the screen. The app will actually give you feedback. How well are your heart rate and your breath moving together? It'll give you a score, and you'll see a little peak in the middle start to form. That's kind of like that green peak we saw earlier, which reflects a nice even balance of sympathetic and parasympathetic. Now, if you get this app, we ask that you change the settings, and that's all listed on the left-hand side, so that you have a nice even inhale and exhale. And then typically around 8 or 9 is going to be a comfortable pace for most individuals. This is based on how many total seconds the breath is, whereas the previous apps were based on how many seconds inhale and exhale. So after today, everything is all individual. So you can call the Positive Choice Wellness Center at 858-616-5600, extension 7, to schedule your individual session. There is myself again, Leighton, Lucia, and Cody, and you can see any of us. I am in Vista on Fridays only. So that is the only place other than the Garfield Specialty Center in Claremont Mesa, which is where the 3 of us are mainly located. You can also go to Vista on Fridays. So if you'd like that appointment with me, or if you'd like to be seen in Vista, just let the front desk know when you schedule. After 15 minutes, we consider you a no-show. If you let us know that you're running late, a lot of times we can still see you. But as you can see at the bottom, it says 7 p.m. appointments need to arrive no later than 6:45. Lucia and Cody, for example, have appointments up until 7 p.m. So you might be their last appointment of the day, and if you're running late and we don't know it, then we might go home. We ask that as often as possible. You try not to cancel within 24 hours. Of course, things come up, and there's no problem. Nothing's going to happen to you if you do so, but we just ask that as often as possible. All of the sessions are 50 minutes, 50 minutes, and there is no cap. So we might see some people for 1 or 2 sessions, and we might see some people for 9 or 10 sessions. We typically schedule about every 3 to 4 weeks because that gives you the chance to go home, to practice, and to get back to us with any questions or concerns or issues, and then we kind of meet back up and check back in and go from there. Now, if you do book one of those 7 p.m. appointments, please arrive prior to 6:45. At 6:59 exactly, our front desk leaves, so we won't be able to check you in for your appointment. But if you try to arrive by 6:45, then we know we can at least most likely get you in. I want to thank you all so much for listening to this slideshow. If you have any questions, please call that number again on the last page, 858-616-5600, and we'd be happy to answer those for you. I hope you have a wonderful day, and I look forward to seeing many of you soon.